Hi everyone. It's a couple of minutes past the half hour, so we'll make a start. So hello, welcome to the webinar today. I'm Ben Moffat. I'm a program and evaluation lead for violence against women and girls at the Youth Endowment Fund. Thank you very much for joining us today to learn about Objective 2 of the VAWG prevention program. And this objective is all about evaluating targeted services for children and young people displaying inappropriate and problematic attitudes and behaviours around gender and relationships in educational settings. Today, we'll take you through who we are as an organisation, as the Youth Endowment Fund, our research around violence against women and girls, and a little bit about the cross-governmental strategy on VAWG as well and how this work fits in. We'll then go into detail about Objective 2 of the prevention programme, before talking a bit about the application and assessment process. We'll cover these at a fairly high level in the webinar, just because we went into more detail on the guidance, which I imagine most people have already accessed. And then we'll talk a bit more about the likely evaluation designs, and we'll try and leave around 45 minutes for questions and answers at the end. We'll move at a fairly quick pace, but these slides and a recording of the webinar will be available on the EF website over the coming few days, so don't worry if you miss anything, you'll be able to refer back. And just to flag that you can start adding questions to the Q&A at any time, and you can also upvote each other's questions if someone's asked something that you're interested in hearing the answer to. Just a quick note on the security measures that we've got in place for this webinar. So we've had some of our partners host webinars recently on similar topics to that we'll be discussing today, and they've been joined by malicious actors who've shared inappropriate content in the webinar. So we've tried to have quite rigorous security measures for this one. That means that you won't be able to come off mute or to come off camera, and so we're asking people to use the Q&A function that's integrated into Teams when we come to them. If there's any accessibility reasons why people can't use that function, then at the end of the webinar, we'll make sure there's a few minutes where people can raise their hand and we can take you off mute. But we ask that people use the Q&A function wherever possible, just so that we're looking after the well-being of our attendees today. Okay, I'm going to hand over to my colleague Jess now, who's going to tell you a bit more about YEF as an organisation.
I'm Jess Southgate. I'm the Violence Against Girls and Young Women lead. So the Youth Endowment Fund, for those of you who don't know us, our focus is on preventing children and young people from becoming involved in violence. We're a what works centre, so we aim to improve the way that government and public bodies share and use high quality evidence and decision making to support more effective services. So our mission is to find out what works and build a movement to put that into practice. So when we look at our strategy, you can see that the way we do this is by funding work, which helps us understand the scale of violence affecting children and young people. That includes evaluations, as we're talking about today, but also systematic reviews, primary research and data analysis. When we find what works, we share this. So we do that through our toolkit of violence prevention approaches, as well as our practice and systems guidance. And then with that evidence, we work for change for system and practice leaders to put those recommendations into practice. And VAWG, of course, cuts across all of the sectors that YEF works in, which you can see on the left-hand side of the slide. And today we're focusing on the really important role that education can play in preventing violence amongst young people. So when we're thinking about the evidence base, a really important part of this programme is to understand more about the evidence in this space. Part of YEF's role, as I say, is to build evidence around violence affecting young people. And we do that partly through our Children Vulnerability and Violence Survey, our CVV survey, through which we found that almost half of teenagers, so 4% of all teenage children in England and Wales, have experienced or perpetrated some form of relationship abuse. We know from wider police data that child sexual abuse and exploitation cases affecting, peer-on-peer child sexual abuse and exploitation cases are increasing. So over half of CSAE perpetrators are aged 10 to 17. The majority of these are young people who are known to each other, and tech is playing a really significant role in the way that is rapidly changing and intensifying patterns of harm. We also know from our CVV survey that children are often exposed to violent misogynistic content online. So 39% in our survey last year had seen social media content that encouraged violence against women and girls, which was an increase from the year before. And we also know that through that survey, 70% of children have seen real world violence online, of which 25% was sexually violent. And that also finds that children exposed to sexual violence online, as well as in person, are more likely to see it as acceptable. And those who see it as acceptable are more likely to perpetrate it themselves. And when we're thinking about education, we know from a teacher TAP survey that we conducted of almost 5,000 secondary school teachers, 13% had said a child had sexually assaulted another child within the last term. So this is a really pressing issue in education settings. This work is part of a wider programme of work, which YF is intending to carry out over the next 18 months. So I mentioned our CVV survey. We'll be publishing new data from that in November this year, with new data around teenage relationship abuse and online harms. We're currently conducting commissioned research around the responses in practice to violence against girls and young women amongst children and young people across children's services, youth justice and policing. We're carrying out secondary data analysis projects around teenage relationship abuse and harmful sexual behaviour. We are developing approaches within our violence prevention toolkit around tech-facilitated abuse, harmful sexual behaviour and universal gender-based violence approaches for children and young people. And the learning from all of that, we will pull together into our system and practice guidance with VAWG system guidance published summer next year. Underpinning all of our work are young people's voices, and we have a subgroup of our youth advisory board with a specific focus on VAWG, who are also informing this work. So the work that we're here to talk about today is the VAWG prevention programme. We're really excited to be delivering this in partnership with the Home Office and the DFE, and to support delivery of the ambitions of the VAWG strategy. The two objectives within the VAWG prevention programme. The first is around promoting healthy and respectful relationships to education in secondary school, and that closes next Monday for anybody who thinks that might be appropriate for them. And then the strand that we're discussing today is objective 2, which is proposals for targeted interventions to prevent emerging problematic gender norms and behaviours that could escalate into harmful behaviours in relationships. And the deadline for that is the 2nd of September. Worth noting as well that if you don't feel that you're ready to apply now, or if you apply this year and your application is unsuccessful, there will be a later opportunity to apply again in a second round in summer 2027, which will be informed by the learning from this round. So the reason that we're focusing and particularly thinking about VAWG in education settings is we know adolescence is a critical time for prevention work when when relationship norms and behaviours are being formed. Intervention for children and young people who are displaying inappropriate or problematic behaviours can prevent these escalating into more serious forms of harm that require statutory interventions. And we know that schools are critical spaces for identifying and supporting children and young people to build healthy relationships. However, we also know that lots of children who exhibit these behaviours but are not supported or do not have referrals taken forward by wider services such as health, social services or the police. And many schools are having to manage those kind of behaviours internally. And concerns about those behaviours, we hear from schools that they do not always feel that they have the capacity or the confidence or access to specialist support to be able to respond effectively. And of course, effective responses require really confident education systems. So we want this objective to better strengthen the ability of schools to identify and address these behaviours. And I will now hand over to Jo Wilson, our colleague from DFE, who can speak to how this is supporting the government's VAWG strategy.
Thanks very much, Jess. So I'm sure many people on this call are familiar with the government's 10-year VAWG strategy with the aim of halving violence against women and girls in the next 10 years. We know that one of the most important strands is that, we know that one of the most important elements of this strategy is prevention, and that it's best to tackle this as early and as fast as we possibly can, which is why we're looking at schools. We're really pleased to be working alongside the Home Office with YEF, who have this expertise and who are an established What Works centre in this space. We're aware that there's a lot of really great work going on in lots of different schools and colleges, and even in some out of school settings, but we don't DfE certainly doesn't have the capacity to review that full picture, and that's why we're investing £16 million to try and get the best results of these pilots for a test and grow evidence module, so that we can roll this out further to all schools by sort of 2029. We're obviously keen to support teachers as much as possible, and we know that many teachers feel that this is a burden, that is a challenge that they can't fulfill. So we're excited to work with external organisations who have some more of that expertise. And as Jess says, we're aware that this is an emerging area. Obviously, DfE and Home Office are doing a great number of other VAWG-related activities. There are 259 commitments in the VAWG strategy, 19 of which belong to my department. So we're also looking at how we can support schools through, we're spending £50 million over the next 3 years on social workers. We're doing enhanced guidance on misogyny within schools. But this really is about the sort of targeted approach, which can be much harder to implement. So we're really grateful for YEF for all their work on this. Am I now handing this back to Ben?
Yes, thank you, Jo. I'll just reshare the slides. Lovely. And then I'll hand over to Jess to talk a bit about what we know around the evidence base in this area.
Thanks, Ben, and thanks, Jo. So part of YES's role is to collate the best available international and UK evidence on violence prevention for children and young people. So what we know from the evidence about relationship and gender norms programming is that across the international evidence base, unequal beliefs about gender roles and male entitlement consistently emerge as really strong predictors of perpetration of VAWG. And that's why prevention work has to engage with attitudes as well as behaviours. So we know that changing attitudes towards acceptable behaviours in relationships, including around consent and coercive control, can play a role in longer term behaviour change. However, there are significant gaps in evidence. So while we have a reasonable picture of what works when we deliver to whole populations of young people, such as all pupils in a 1 year group, we know far less about how to intervene effectively with young people who are already showing concerning behaviours or who are at heightened levels of risk. So we also know little about how young people, parents, teachers, practitioners, all those involved experience these programmes and evaluations and what is acceptable to them. And whilst many evaluations report averages for the whole group, we can't say as much with confidence about whether programmes work equally well for different groups of young people, including neurodivergent young people, those with special educational needs, or those from minoritised communities. And schools are often the first settings to notice harmful behaviours, but there's very little evidence around what practical support, training or guidance helps staff to respond confidently and consistently so that they're able to address the issue in the moment. And we also don't know a huge amount about what the best evaluation designs for these types of programmes specifically. I will now hand back to to Ben, who's going to talk through Objective 2 of the programme.
Thank you, Jess. So as I mentioned earlier, I don't want to go into too much depth about the objective just because there's much more detail on the guidance. So if you haven't checked that out yet, I would really encourage you to. But for this objective, we're really looking to fund and evaluate targeted interventions for children and young people aged 10 to 18 who are displaying inappropriate or problematic attitudes and behaviours around gender and relationships. And within this slide, we're just trying to give you a bit of an idea of what we would think is in scope for this objective and what is out of scope. So we really want to fund interventions that are focused on pre-threshold behaviours before they require statutory interventions. And I'll say a bit more about what we think these kind of behaviours might look like in a second. But we aren't looking to fund interventions that address harm that has escalated to require statutory involvement, such as from social care, police, or criminal justice. That would move into a bit more of a tertiary prevention space when you're addressing harm that has already escalated to quite a severe level. Likewise, we're not looking to fund universal delivery, where you're delivering to a whole class or school or year group where there's no targeting. That would fall under our objective 1 with the VAWG prevention program. So if you haven't checked that out and that sounds like an intervention that you're proposing, then please do review our guidance there and see if that might be a better fit for you. The work that we fund here will need to have a really clear link to educational settings. So as we've heard from Joe and Jess, we know that educational settings are increasingly being asked to identify and respond to these behaviours, without necessarily close support from other agencies, particularly where they're in these pre-thresholds. And so we're not looking for interventions that are delivered primarily in community where there's only a very tenuous link to education settings, such as a referral link. There needs to be a clear partnership and a clear feedback mechanism between the intervention and the educational setting, where the intervention is improving the school's ability to identify and respond to these kind of behaviours. And finally, we are looking for interventions that show that they understand the potential effects that delivering an intervention with children and people who are starting to display these inappropriate and problematic attitudes and behaviours, what delivering that intervention, the effect it has on their peers in the school who might have been victims of these kind of behaviours, and how they might address any of the risks or unintended consequences that might come about through service delivery. We're also looking for interventions that have been delivered previously in some form, even if it requires some adapting to meet the parameters of this objective. But we're not looking to fund things that are completely new, where there's no prior delivery and no previous track record of the intervention anywhere. And my colleague Phil will talk a bit more about the evaluation designs later. But for this objective, in comparison to objective 1, we're focusing really on early stage evaluation primarily. So feasibility studies or pilot RCTs. And I want to talk a bit about some of the examples of inappropriate and problematic behaviours that we'd expect to see interventions addressing. We've got some detail of this in the guidance, and I've also put some on the slide here as well. We know that these are the kind of behaviours that schools and other educational settings are increasingly responsible for identifying and responding to internally. So some of the examples that we've listed here include things like sexist and misogynistic language, unwanted sexualized comments, poor understanding of consent and boundaries, controlling, possessive, or intimidating behaviors, harmful online behaviors like sharing inappropriate content or harassing their peers, attitudes that normalize gender inequality, disrespect or violence towards women and girls, and other indicators of unhealthy relationship behaviors that are known to increase the risk of future harm. The kind of things that we think would be out of scope because they are maybe below the threshold that we would expect for targeted intervention would be things like children and young people engaging in age-appropriate relationships where there are kind of ordinary disagreements and the relationship is conducive to their stage of development. A young person being in a relationship we wouldn't think would make them eligible by itself for this intervention. Likewise, as we've mentioned, we aren't looking for tertiary prevention services, so we're not looking for interventions that are addressing behaviours that are moving into the more severe harm, statutory intervention space. So we would expect that behaviours like force, coercion, threats and intimidation, sexual abuse or exploitation, repeated abuse, and serious online abuse or image sharing without consent. Those kind of behaviours we would think would require a statutory level of intervention, and so we wouldn't really expect the interventions we fund here to address them. We just took you through this list, but I want to highlight that this isn't definitive. These are some examples that we propose to kind of help you as you're thinking about the scope of this objective. We recognise that there's lots of expertise in the sector. There'll be lots of expertise on this call of people who have delivered these kind of interventions before, who work really closely with educational settings. And so you're very welcome to propose a different list of attitudes and behaviours that your intervention is seeking to address around gender and relationships. We're really looking for you to highlight those in your application and to provide a good justification for them. And finally, you might also want to consider how behaviours might be approached differently depending on the age of the child when you're developing your application, particularly for those who are working with young people who are 18 years old and therefore legally adults. I also want to highlight that we, as with all our programs at YEF, we have a commitment to equity. And we know that violence disproportionately affects marginalised children and young people more, and they might often face additional barriers to accessing support. So we require applicants to demonstrate that they'll meet the needs of diverse groups of children and young people, such as around gender, ethnicity, special educational needs and disabilities, and neurodivergence. So how their intervention works with children and people with different needs and adapts based on their cultural backgrounds would be the kind of information that we'll be looking for in applications. And as we are looking to fund targeted services, we'll be looking to ensure that applicants are considering how they'll prevent unconscious biases from influencing selection of children and people or reinforcing negative stereotypes when it comes to screening and accepting referrals from educational settings. Applicants should also demonstrate confidence in navigating different cultural perspectives and around relationships and gender norms, recognizing that there might be a diversity of views around the appropriateness of different relationship and sex health education content, but always bring it back to British values and what's expected in the statutory curriculum. And equity will be a core assessment criterion when we come to assessing the applications. And that's not just thinking about the projects as well. We recognise that equity is also considered in an organisational lens. And so we particularly welcome proposals from organisations which are led by Black, Asian, or other racially minoritized leaders, and also applications from women-led organisations as well. And we really do see the VAWG prevention programme across both objectives as a collaborative learning process. So we want to work with partners to identify the best bets around implementation, disseminate ongoing learning as we go, with the aim of improving policy and practice around violence against women and girls long term. And we'll, where appropriate and possible, we'll source wider expertise, such as through Race Equity Associates, to help improve ongoing practice. And throughout the delivery of the objective, we'll look for opportunities to bring partners together as a bit of a network of fellow travellers, all looking to improve service provision in this area, so that you can share your experiences and best tips on implementation and the like. And we hope that by the end of the evaluation, in addition from the findings of the formal evaluation report, you'd end the experience with a better understanding of how your intervention works, under what circumstances and for whom, and that should help you hone your practice closely thereafter. I also want to take a moment to discuss how we support partners through our co-design process. So this is a really key part of our commissioning and application process. It's essentially where applicants who've been approved by YEF and our Grants and Evaluation Committee to the second stage of developing their proposal are partnered with an evaluator to develop the full delivery and evaluation proposal. So that'll be going into depth on things like eligibility criteria, evaluation design, outcomes, data collection measures, and it'll also be an opportunity where you can refine your theory of change. The process is led by the evaluator, but with delivery partners having really key responsibilities alongside that. And the partners will also be supported by 1 or 2 YEF members of staff and also possibly a Race Equity Associate. It primarily consists of a series of workshops, but with some key work outside those sessions, and culminates in submission of a final proposal to YEF, which will then be assessed and a decision made around whether to progress to the proposed evaluation. We're asking applicants at this stage to anticipate a 4-month co-design process from November of this year to February 2027, with submission of the final proposal for review in March. But partners will be able to recommend an extended co-design process of up to 13 months in total early in the co-design process if you think that's what's needed for your intervention. and we'll negotiate a budget to fund partners' participation in the co-design process up to a maximum of £20,000 for the 4 months, and then scaling up moderately for extended periods to make sure that we're reimbursing you for the time that you're putting towards that process. And we're really trying to take this flexible approach to co-design process and ensuring we can give longer than we would usually as part of YEF to make sure that we're providing the right support to selected partners wherever your intervention is in your evidence journey. And so we're making sure that whatever evaluation design you propose is the right one. I'll now talk to you a bit more about the application process. As I say, a lot of this will be in the guidance, but I'll take you through it at a bit of a high level. So applications are now open and will close on Wednesday, the 2nd of September at 9 AM. Please do submit your applications before then, as we're unable to consider any proposals that are submitted after that deadline. We'll then shortlist a series of proposals for interview, which will take place from 22nd of September to the 9th of October. That'll be our opportunity to learn more about your organisation and intervention, and it'll also be your opportunity to ask us any questions about the commissioning process or about the likely evaluation design. And we'd really request that applicants try and ensure that they've got good availability during that time to have an interview with the right panel. From there, we'll embark on our internal decision-making process at YEF. That will start with making an internal decision about which projects we would like to advance to co-design, and then recommending a slate to our Grants and Evaluation Committee, who have final say in our funding decisions, and they'll meet in early November. While this is happening, we'll match our intended projects with an evaluator from our panel of evaluators, and you'll hear a little bit more about this process later. Project and evaluation partners will then collaborate in the co-design process that I mentioned earlier, and then submit a final proposal for delivering and evaluating their intervention, likely in March 2027, but in later periods if they go for an extended co-design process. We'll then review the final proposal following submission and decide whether to progress to the evaluation. Please note, though, that co-design is still part of our application process, and we can't guarantee that proposals which make it to that stage will then progress to delivery of their evaluation. But if your final proposal is approved, we would then progress you into setup. To access the application materials, please do go to the VAWG Prevention Programme Objective 2 page of our website. And as I mentioned, please submit your completed application form and indicative budget to our grants inbox no later than 9 AM Wednesday, the 2nd of September, with a subject line of VAWG Prevention Programme Objective 2. I'll briefly also take you through the assessment criteria so that you understand the basis on which our decisions are being made. So when we come to review your application, we'll be looking for things like a suitable outcome, making sure that the project outcomes that you're invested in match the objectives aims, so around gender and preventing gender and relationship violence and violence against women and girls long term. And that the intervention is likely to be able to achieve those outcomes. We'll be looking to see that you're able to engage children and young people and school staff. So seeing who you plan to work with, how you plan to engage them, and what your experience is working with this cohort, and how the proposal considers our objectives around race equity. We'll be looking to see your organizational expertise, and I'll say a bit more on this in a second, but basically whether you have the experience and expertise to deliver your proposed intervention within the context of an evaluation, whether the intervention draws on the best available existing evidence around content and implementation, whether the intervention is evaluable, and whether it can be evaluated through a feasibility study or pilot RCT, and whether there is likely potential to eventually scale up to a full-scale impact evaluation. We'll also be looking at your budget and seeing whether the funding requested is in line with your wider proposal, is sufficient for delivering the intervention within the context of an evaluation, and we'll also be considering whether the intervention represents good value for money in terms of it could be accommodated by educational setting budgets long-term outside the context of a YEF evaluation. And finally, we'll be looking to see that the intervention is likely to lead to change. So a core part of YEF strategy, as we've heard, is encouraging the scaling of effective interventions. And so we'll assess whether the intervention is likely to be adopted by schools outside of a YEF trial, and that it fits with the cross-governmental strategy on VAWG and wider policy and practice trends as well. I mentioned that we'll be assessing organizational expertise. I just wanted to highlight that there's two main areas that we want to think about. So as mentioned previously, we're looking to develop a pipeline of promising interventions in the space. And so we're welcoming applications for services which employ very different approaches to things like format, dosage, curriculum, content, and at various levels of maturity and evaluation readiness, just in recognition that this is an area of a growing evidence base, and we're starting from an area where we want to really find out what's already out there. But we will be assessing applications to ensure that funded organizations do have that necessary experience and expertise to facilitate really high quality delivery of their proposed intervention. And so we'll expect that most organizations will have experience of delivering targeted interventions around gender and relationships to children and young people. That's a really core part of our eligibility criteria that you'll see in the application form. But also we are really looking for organizations that have good experience of working in close partnership with educational settings, not just as a referral partner, but in the kind of partnership that strengthens the school's ability to identify and respond to these behaviours in pupils long term. Okay, I'm going to hand over now to Phil, who's going to talk to you a bit about the evaluation design.
Thanks, Ben. Am I controlling the slides?
I'm controlling the slides, but
Thanks, Ben. I'm going to talk you through a bit about the Youth Endowment Fund's approach to evaluation as it will affect you in these projects. Thanks, Ben. So YEF has been making grants to project teams and to evaluators over the last 7 years. We've got quite a good track record. We're currently, or have finished, evaluating 90 interventions. And the breakdowns there on the screens, 53 of those are impact evaluations, which means they are very robust randomized control trials. 30 of those 90 are pilots of randomized control trials, and 13 are feasibility studies. And that's across the different 7 sectors that the organisation works in. We don't currently have other projects in this particular strand in this space, so that's in targeted programmes on prevention for VAWG. What we have here is some guidance which you can find on the YEF website about how we conduct feasibility studies. That's the first guidance document, and pilot randomised control trials, the second document. It's a good reference point if you want to learn a bit more about how we approach feasibility or pilot studies in comparison to full RCTs. What's important to say is that we treat the programme delivery and the evaluation as 2 parts of the whole. Really, these 2 things come together. We don't sort of give grants for programme delivery that doesn't have an evaluation, and of course the evaluation has to be evaluating a project. So if you're successful, you will be working closely with an evaluation partner to bring both the delivery side and the evaluation side together into something which will work as a study overall. So why do we want to evaluate? The main thing is captured here in the phrase to learn what works for whom, when and how. So we want to learn what works. We want to support you so that you learn what works about your program, so that you can improve them, so that you have the right language to talk to children and families and schools about your work, and so you can communicate well with funders about your program from an evidence point of view. We want to make sure that we're building the evidence base for prevention programs, which has several gaps at the moment, and we're trying to fill those gaps to strengthen the sector and strengthen future projects and the design of future delivery designs. Of course, the overall thing is that we want to encourage good practice. We want to find out what works so that it can lead to scaling of interventions to improve the situation for children and young people. Thanks, Ben. YEF's overall principles, which apply to randomised control trials that underpin all our evaluation work, rest on these 3 key words: robustness, reliability, and rigorousness. So we normally apply these to randomised control trials. We do a very robust design. We make sure that all the measures we use or the processes we use in evaluations are very reliable, and we make sure that we implement it in a very rigorous way. In a minute, I'll come on to talk about the feasibility studies and pilot studies that we are expecting in this strand of work, but to say that they are early stages of full randomised control trials, and these 3 principles of robustness, reliability, and rigorousness underpin all of the evaluation work that we do. Thanks, Ben. So on the screen, we have sort of a ladder of types of analysis you can do for on projects. Many of the studies that we conduct in other areas of work are at this level 6 test for efficacy. So this is a randomized control trial, quite large scale, extremely rigorous, designed for very mature interventions where the design is very fixed, very confident that it can be delivered reliably, consistently, and a very high standard. We anticipate that in this space, many of the interventions will still need to be testing a few things and won't be quite ready for that full randomized controlled trial. So we're anticipating the projects in this funding call will fit into levels 4, level 5, which is a feasibility study or a pilot for randomized controlled trial. Thanks, Ben. I'm going to talk through a bit about those two different types of study and what they might look like. So feasibility study, give you a quick contrast first. The feasibility study, the main thing is, can the intervention be delivered as you're anticipating to be delivered? Can evaluation happen in the way that's being proposed it could happen? Is it feasible to conduct this intervention and to evaluate in the way that's being proposed? In contrast, a pilot randomized control trial is a small scale randomized controlled, full randomized control trial. It has all the rigor, all the structure, all the confinements of a randomized control trial, but on a much smaller scale. So I'll go back to feasibility study. So generally we're looking for intervention feasibility and evaluation feasibility. That means the way we think we can implement this project with these stakeholders, with this level of support, is that realistic? Is it feasible? Can it be done in practice? On evaluation feasibility, we're talking about the way we want to assess whether it's successful. Is that feasible? Is it realistic? Can it be done in the time? Does it give accurate results? Do people respond to our questionnaires, for example? Those are the kind of feasibility things we might test on the evaluation side. It goes back to the randomized control trials. So pilot randomized control trials. They're a small scale version of a full randomized trial. They're confined. You need to be very rigorous, and you need to have the design that you want to test to be pretty sure and pretty happy about it at that stage. You can see the guidance for more notes on that. Thanks, Ben. For a pilot randomized control trial, there are some requirements in terms of scale. They're not fixed, they vary from project to project. We wanted to give an example of the kind of scale which might be required for these kind of projects. But in this example, we said that the pilot would involve 200 young people, and because it's a randomized trial, you'd have 100 randomized to the intervention group. They would receive your program, and 100 would be randomized to a control group. They wouldn't receive your intervention. In this example, I've split those 100 young people into 10 school year groups as a way of illustrating. The idea of this is to give you understanding of the scale that might be required in a pilot randomized control trial, and to make it really clear that you'd have both young people in the intervention in your project, and you'd have the same number of people who don't receive your intervention, but that you collect data from, you test whether they can be involved as the control group. Thank you. So the way this will work is you will put your application in, which will go through the assessment process. We will then match you with an experienced evaluator from our evaluation pool, specialised with VAWG and GBV programmes. So that matching will take place based on the type of project that you have, the sort of specialism within the portfolio of projects we're looking at, and sort of the matching specialisms and experience within evaluation organisation. You would then sit down, you will sit down in the co-design process with those evaluators and work through refining your study design, merging sort of the assessment criteria and assessment process with your implementation details to produce that final study design which comes back for approval. Thanks, Ben. And just back to our overall process. So the bit we just talked about, which is about evaluation matching, evaluator matching, is the yellow box in the end of the first stage. So you put in your application. If your application is selected to be put forward to our grants evaluation committee. At that stage, you'll be matched with the evaluator. And then if your project is approved by our grants evaluation committee, you would move forward with that evaluator into the extended co-design process. Back to you, Ben.
Wonderful. Thank you, Phil. So that's the end of our formal presentation. We've now got plenty of time for questions. So please do pop those into the Q&A function as we go, and we'll make sure we hold a few minutes at the end in case anyone needs to raise their hand and come off mute instead. I'm okay to hand over to you, Phil.
Great. So I'm going to go through the Q&As, picking the questions from the top of the list, sorted by the number of upvotes that have had. So if you like a question that you want to be answered, please vote it up in the Q&A section, and it'll be sort of put out earlier. So the first one, Ben, maybe for you. Can we apply for both Objective 1 and Objective 2 if an organisation has a programme which is a solution to both?
Sure, good question. So absolutely, we can accept applications for both Objective 1 and Objective 2 from the same organisations. That's no problem at all. We'd just like to understand your capacity to take part in both if you were to be shortlisted for both, but we can definitely dig into that more in the interview if you're shortlisted for that stage. Maybe just within your applications, please do indicate if you're planning to apply for both. In terms of if you have a program that fits both objectives, generally we would think that there's probably quite clear blue water between the objectives. And so Objective 1 is all about universal provision, delivering to a whole class, year group or school. Objective 2 is the targeted provision. So delivering to children and young people who have known identified risk factors that mean that they are demonstrating these emerging inappropriate and problematic behaviours and attitudes. And so we wouldn't generally think that a programme would fulfil both objectives and could be evaluated through both means. If you are applying with an intervention which has elements of both, so you might do a universal provision element, and then with children and young people who might benefit from further support, doing further work with them, we'd encourage you to maybe get in touch with us and talk about that a little bit more. I think in that case, we probably want to try and tease out those two elements because we wouldn't be able to consider them. So we wouldn't be able to consider them together for either objective because they fall without scope. So get in touch if that's relevant to you.
Thanks, Ben. The next one, partly for you, and then I can respond also from a valuation point of view. Are you looking for a small number of providers to roll out across the country, or multiple local offers? That's the first bit.
Yep, another good question. So I think for this objective, we are focused on more early evaluation, and so we're expecting the scale of delivery to be at a lower level for most applications than we were expecting for Objective 1, which was efficacy studies requiring large-scale trials. Because we're looking to do more early stage evaluation, I probably suggest people lean towards proposing a design whereby they're relying on really strong experience of delivery, kind of quite a cohesive and tight parameter of delivery, rather than trying to extend and scale up themselves. I think you'll see in the guidance that we've got proposals for the number of children and young people in schools that we foresee taking part in a feasibility study compared to a pilot RCT. We'd recommend that applicants think about which one of those is best suited to their experience and their plans for delivery, to see which of those designs they'd propose within their application. But if you're delivering to, say, 5 schools and you can do that comfortably, we'd recommend that you proceed on those levels rather than thinking that you have to scale up to say 20 schools in order to be eligible for pilot RCT. I think trying to keep it quite cohesive is probably best for this application.
Thanks, Ben. I think we answered the next bit of the question, which was about minimum number of students and schools. It's the details are in the guidance notes. And last bit of the question: what's the maximum budget?
We're not setting minimum and maximum budgets for this. We really would like to hear from partners how much it takes to deliver the intervention that they're proposing. We recognise that this could be quite varied depending on the intervention in question. So more therapeutic interventions, for example, might cost a bit more because it will rely on very skilled practitioners, compared to maybe some other interventions that might cost a little bit less. When we come to review your budget, we'll be thinking about whether the budget seems to be sufficient for delivering the intervention within the parameters that you're suggesting, so to the number of schools and children and young people that you're planning to deliver to, and that it kind of, you can read it alongside the delivery proposal and they do match up. We'll also be thinking about value for money, but really when we think about that, we're thinking about, will schools be able to accommodate this long term outside the context of the EF trial? Because if they can't, and even if it's proved to be effective, it might not lead to that long term practice and policy change that we are looking for. But yeah, we try not to set minimum and maximum budget expectations, just because I think it gives the wrong impression. Sometimes if we give maximum budget expectations, then people can maybe apply with budgets that are less than what they need, which can produce risk later on. Likewise, if we produce minimum budget expectations, then people can apply for more funding than they actually need. So yeah, we try not to give hard and fast rules. Please just apply with whatever you think is necessary.
Thanks, Ben. Sam, onto your question. For a feasibility study stage project, how many young people would you expect to engage? I understood the RCT would need to engage about 200 young people. Would feasibility be less? I can take that if you like. Certainly we would expect it to be less. I think in the guidance note we suggested 50 young people, 5 schools in the intervention, and you might want to try outside of that. So it would be considerably less, 50 to 100 young people, small number of schools. If you think about it as you're really just inquiring about whether the design is implementable, whether it's acceptable, whether the evaluation mechanisms can be rolled out. So it is a much smaller key when you've got I mean, you want to do a feasibility study when you've got key questions still about exactly how will the design work, how could the evaluation mechanisms work for your project, and it would be relatively small scale. Thanks. Sharon, can this application be a consortium approach between different football clubs, community organisations or schools? Can you take that?
Yeah, of course. Absolutely. You can apply in partnership with other organisations. When we come to review the application, we'll just be making sure that it's clear kind of what the role of each partner is, that there is a lead partner who would be, yes, grantee and responsible for coordinating the overall delivery of the intervention and supporting the evaluation. We'll also be looking to make sure that just when you bring in more partners, it increases the complexity of delivery. That might be no bad thing if it's leading to increased expertise and scale of delivery and that kind of thing. But we'll be looking to ensure that that complexity is justified by what every partner's bringing, essentially. Just to reiterate that we're not we don't have really clear scale requirements for this, just because we are focused on those early stage evaluations. So if you are proposing a pilot RCT, you would need to expect to deliver to more children and people than, say, a feasibility study, but don't feel the pressure to go for a pilot RCT if you think that's starting to stretch your scale of delivery beyond what you could comfortably manage. It's probably better to apply for a feasibility study if that's the case, and be a bit more confident in your proposal. So if you are planning to partner with multiple schools, football partnerships, wider organisations, that's absolutely fine. But just make sure you highlight in the application what each partner's role is and why they're coming on board for this project.
Thanks, Ben. There's a question here about schools and summer holidays. As it's summer holidays, some schools are not able to send partnership letters at the moment. Can we submit partnership letters later?
Yes, absolutely. So at this stage, we wouldn't expect necessarily schools to provide formal indication that they would sign up to an evaluation, just because there's too many unknowns at this stage. We wouldn't know exactly when the delivery is. What we would be seeking to understand is things like the strength of your network in which delivery sites you're expecting to deliver in, what kind of schools, where they are, and the strength of your relationship with those schools. If you can provide letters of support, then please do. But if you can't, that's absolutely fine. We'll expect that to come later, probably in the co-design process.
Thanks, Ben. Next question. We have extensive experience delivering mentoring programs currently in 10+ secondary schools focus on preventing offending and reoffending. We also have significant experience delivering group-based workshops and interventions related to VAWG. So while we have experience in both areas separately, we have not yet delivered a mentoring program specifically focused on VAWG, though aspects are covered in our mentoring. Would this experience be eligible to be considered for feasibility study?
Sure. I think that it sounds like you've got good experience in delivering this mentorship intervention and also good experience in delivering interventions around violence against women and girls. So as long as that experience also includes working with the kind of children and young people that we expect to work with here, and also on interventions that address these kind of inappropriate and problematic behaviours, you would be able to apply for a more targeted mentorship programme that draws on those elements. That would clear the bar for our eligibility criteria. We would just need to understand your organizational experience in working around that VAWG inappropriate and problematic behavior, gender and relationship space, and also how you plan to adapt the intervention to kind of like bring those two strands together.
Thanks, Ben. Next question is about children who are educated at home. So this person is really asking if the programme will support projects that support, I'll use the phrase, the lives of elective home educated children.
Thank you. I think there is a growing proportion, I think, of elected homeschool children. And certainly we would, as an organisation, we would definitely support interventions that try and support those children and young people outside of educational settings. Within the scope of this objective, we are focused primarily on educational settings. And so interventions that look to support those elected home education children and young people exclusively would probably fall out of scope for what we're looking for here, even if they we would absolutely champion the work that those organizations might be doing to try and address youth violence in this space. It probably doesn't sound like it's right for this call.
Thanks, Ben. There's a quick question to refresh on where the application form is. Jess, thanks for putting the link in the, it's not as a response to the question. If anybody else is looking for the link, they'll find it there under Solomon's question in the Q&A. Thanks. Liz, we are a small micro charity. Would we still be considered?
Yes, absolutely. So we really do want to try and support smaller organisations, particularly those that are really well embedded with communities, and that might be quite grassroots, and particularly those that might work closely with minoritized communities as well. You can see the eligibility criteria for organizations in our guidance. There's the things that we've already discussed around experience and working in this area, but also there's a requirement around the kind of bodies that we support. So those can include registered charities, community interest companies. We just can't fund individuals. It has to be a registered company or charity.
Thanks, Ben. Next question from Jade. I have a project that isn't up and running yet. Will it be eligible?
So we can't fund entirely new interventions within this objective, but what we can fund are interventions that are being pioneered in new spaces. So say if they've been delivered in the community before, but you're planning to deliver them in educational settings, that would be eligible. Likewise, we're open to funding and evaluating interventions that have been delivered maybe with a slightly different cohort for this new work. So maybe they've been delivered to children and people at risk of other forms of violence. Now it's being proposed to deliver to these children and people who are displaying inappropriate and problematic behaviours around gender and relationships. But if that's the case, then we need to understand that the organisation has experience of delivering other kind of work with those children and young people. So as long as the intervention, as long as you're proposing to deliver the intervention within this new space, and as an organisation you've also got experience working around violence against women and girls, gender and relationships, then we would be able to accept a proposal.
Thanks, Ben. Next question from Anita. In terms of school selection for the evaluation design, how do you ensure that the intervention and I think it's control group are similar to have a similar demographic profile? Does the control group need to be from the same school or different? Perhaps I can respond to this. So, for example, in a pilot randomised control trial, you would set the eligibility criteria for the schools first. You would then bring schools in, enrol them into the study, and then you would randomise. So between the eligibility criteria and the randomization process is how you even out differences between the schools in the intervention group and the schools in the control group. That's the example. If you're randomizing by schools, you might be randomizing by, say, a year group or other group in a school, so that there the randomization happens at that level rather than the school level. But the same principle applies. It's randomization is what you use to spread out the differences between the groups and the young people in the intervention who receive the project and those in the control arm. Joe, thanks for your comment there. DfE can offer some support in engaging and selecting schools. Thanks for that, Joe. Next question. Can you clarify what you mean by a targeted program? You said you don't want programs for all class or year groups.
Yeah, should I take that one? So I guess what we're trying to differentiate between is universal delivery, which was covered in our objective 1, and that's where children, young people, an intervention is delivered to all children and young people within a setting, so a school, a classroom, or a year group, without any targeting. So as long as they're present within that setting, as long as they're attending that school in universal provision, they would be offered and receive that intervention. For this objective, objective 2, we're focused on targeted provision, and that means that the children and young people who are being referred into the program would need to be exhibiting some kind of risk factors to say that they are at risk or currently exhibiting inappropriate and problematic attitudes and behaviours around gender and relationships. So it couldn't be that for this objective, a delivery partner would go into a school and deliver to, say, a random selection of participants, or to an entire class, or to just any child or young person who signed up. It would have to be referrals because they're exhibiting these kind of behaviours. We expect that those referrals would probably come from teachers and wider school staff and things like that. And the risk factors would have to be relevant for this call. So it would be things like they're known to have quite sexist views, or they've displayed a disregard for consent, or they've been sharing indecent images, that kind of thing. Those are the kind of risk factors that we would generally expect. I hope that's answered your question.
Thanks, Ben. Next question. Can delivery partners have a say in who the evaluator partner is? So I can take this one. So the general answer is no, that we will do the matching process. There's an exception that if you already have a close relationship with an evaluator, and this is you want to put this in as a joint application between the two, then we don't really allow a joint application, but we'd ask you to mention on your application who your preferred evaluator is. And we ask the evaluator to apply through our evaluation call that we put out at the moment. That is only for evaluation organisations who are already on YES evaluation panel. So in their application, we ask them to note that they are interested in evaluating your project. So that's how we handle the general case is that we will do the matching, and the more specific case, if you've got a strong relationship already with an evaluator that you're very keen on, to mention it in your application, and the evaluator should also mention it in their application. Thanks. Next question from Kerry. I currently deliver a specific intervention to girls only. Could we submit an application?
I can take that one. So we would be able to accept an intervention that worked with girls only if those girls were displaying these inappropriate and problematic behaviours, attitudes and behaviours around gender and relationships. We're not looking to fund exclusively interventions that work with children and people who've been victimized by these kind of behaviours, or who are at risk of these kind of behaviours. So at risk of, say, entering into relationships where abuse is present. This is, of course, really important work, but it's not quite within the objective of what we're looking for here. So absolutely, you could apply with a project that's just for girls, so long as they are the ones who are exhibiting these inappropriate and problematic behaviours and attitudes. And we'd also expect within your application that you would kind of articulate why you were focusing exclusively on girls within your intervention. Likewise, if you were focusing exclusively on boys, we'd expect a bit of a rationale to that.
Thanks, Ben. And I think that answers the second bit of the question, which is what is Jeff's preference? Would we prefer to projects that respond to both boys and girls? I think it's down to that rationale that you mentioned. So give your rationale why you want to target, why you want to participants to be one group rather than both.
Absolutely, yeah. We do know that violence against women and girls is disproportionately committed by boys, and so we would generally expect that most of the applications we'd receive, if they were targeting by gender, then it would focus on boys. But that's not to say that we would disregard applications that were focused on girls if they had a good rationale.
Thanks, Ben. Okay.
Yeah, sorry, I just want to say, Jess, would you want to add anything to that?
No.
Thanks. Okay, so next question. Will you be spreading the funding across the country, or would you consider the more than one proposal from within one local authority?
We would definitely love to support interventions across England. I should say that the delivery is exclusively for England, but we'd really like to see widespread provision across the country if possible, to make sure that we're working within a lot of different contexts. Definitely we can accept multiple proposals from the same local authority. We would just need to think if we were shortlisting both and then bringing both through to co-design, that they were trying to work with different schools. I think it would probably be quite difficult to accommodate two projects that were working within the same school, just because there'd be contamination effects between the evaluation. But definitely, yeah, we can accept multiple proposals from same areas.
Thanks. On to the next question. What kind of referral pathways or identification processes for young people displaying emergency, inappropriate or problematic attitudes and behaviours would you consider good practice for this funding call?
That's a really good question. For this objective, our starting position is that we generally expect that referrals are done by teachers and educational setting staff who know these children and people quite well and can identify when they're exhibiting some of these behaviours and attitudes. What the criteria is and exactly how the referral mechanisms will look. We would love to hear from partners who are already working in this area about how they do this and to propose that in their application form. As I say, we're looking to kind of share learning as we go through the co-design process and then into setup and delivery. And so that might involve trying to help share learning between partners about how they manualize the eligibility criteria, the best way to do referrals, the best way to kind of get consent from the children, young people, and often their parents in order to take part in the intervention and evaluation. But yeah, we'd really like to hear from partners what their proposals are. What I would just reiterate is that these do need to be really well linked in with the educational settings. So if you're expecting community referrals to the programme, we would just need to make sure that there was still that really strong link with the educational setting.
Thanks, Ben. Next question from Anita. If you have a project model that had an evaluation completed previously, e.g. evaluating a particular element of delivery, e.g. mixed gender versus single gender intervention, would you still be interested? Perhaps I can comment on this. Thanks for the question. So it comes back to what are you trying to do with the evaluation? What are you trying to find out in the evaluation? Obviously, if you've answered the question already through a previous piece of work, then we don't need to answer the question again. If there's other questions that haven't been answered already that you would like to explore through this funding opportunity, then I think you're welcome to apply. Anybody like to add to that?
Nope, I think that covers it. Thank you.
Great. Thanks. Joe, do we need schools on board before submitting the application? I think, Ben, you covered this earlier.
Yes, I think we definitely want to understand the strength of your network and relationship with these schools, where you intend to deliver, how you intend to get them on board. I think because the link with the educational setting needs to be really good and tight, and we're piloting quite new work here, I think those relationships do probably need to be somewhat already in place, and that you need to be confident that you can deliver the intervention in those settings. That doesn't necessarily need to be that they've signed a letter to say yes, they're fully on board, given that the parameters we won't know until co-design. But we would be seeking to understand the strength of your relationships there and to hear a bit more about why you are confident in your ability to be able to deliver in those schools. If you're able to provide letters of support from those schools, then that's fantastic, but it's not a prerequisite for your application.
Thanks, Ben. Question about just the terminology of targeted. When you say targeted, do you mean in the sense of small group and or one-to-one work?
So we're absolutely open to both. So targeted in this case just means that your eligibility criteria is around risk factors, that it's not just open to any child or young person within a class, year group or school, that you are targeting for those risk factors around inappropriate and problematic attitudes and behaviours. The format of the intervention can be one-to-one or it can be group-based. That's absolutely, we're really open to supporting proposals for both.
Thanks, Ben. We have 3 questions about sort of the registration status of the organisation applying for the bid. First question is, can a CIC apply?
Yes, absolutely. We're open to accepting bids from community interest companies. Maybe actually just this might inform some of the later questions. When we come to the co-design process, if you're brought through to that stage, we would just need to conduct a series of due diligence checks to make sure that that any organisations we fund have the capacity, the policies around safeguarding and race, equity, diversity and inclusion, that kind of thing, in order to deliver these interventions safely and securely. And as part of that, we will be looking to see how much of the grant that we're looking to award makes up of your organizational income, to make sure that you would have the opportunity, you would have the ability to process and manage those kind of funds. Hopefully that kind of helps maybe address some of the other questions, but yeah, but overall, absolutely really happy to fund community interest companies.
Thanks. And related question, do all organisations have to be a CIC, limited or charity? I live across England as a sole trader in partnership with schools, third sector organisations, local authorities. Could I get a lead organisation to lead on the governance? Would I need to become a limited company?
Good question. I don't think we can fund sole traders with our work. So it would need to be a registered company or charity or community interest company registered with the Charity Commission or Companies House in order to receive our grant funding. So yes, it would need to be an organisation that was registered in those ways.
Thanks, Ben. And the third question, can you fund a non-UK but South African registered charity?
No, so the funds would need to be provided to a UK, an England-based charity, really. We could support an England-based organisation to bring a intervention from abroad. For this objective, for the call that we're discussing today, which will close in a few weeks, on the 2nd of September, if it is an international intervention, then it would need to have been gone through a bit of an adaptation process already for delivery in England to be eligible right now. But if it's an intervention that you know of that's abroad, that's maybe got a good, strong evidence base in this area, we'd love to hear about it. Please do email us separately because we might be able to consider that as part of a separate work stream that we're doing. But it wouldn't be relevant for this call unless it had already gone through that adaptation process.
Thanks, Ben. Question from Joe. Does the intervention need to be in school hours or could it be after school but linked to school?
Yep, thank you. So it could absolutely be outside of school hours, and there might be very good reasons why you'd want to run an intervention like this outside of curriculum time, not least to make sure that you're not bringing children and people out of lessons. So it could absolutely be delivered outside of school hours, so long as, again, that's got that really strong link with the educational setting, that it's not just referring children and people to a community setting outside of school hours, and there's no kind of partnership and feedback loop back into that school.
Thanks, Ben. Another question. Is it better to focus on one area or borough, or can we choose 2 areas to compare our findings? Can I take this one? So if you're proposing a pilot randomized control trial, then whichever you choose, one area or say one borough or 2 boroughs, the schools that you pick in those areas would go into the sort of bucket, and then you would randomize them from that into the intervention arm and the control arm. So it's not the case that you could compare intervening in one borough with not intervening in another borough. It's rather that the two groups, the intervention schools and the control schools, would be spread across the two boroughs. So it's not, in this process, it's not possible to compare, as you suggest, it across two boroughs. Another question, will there be another call for objective 1?
For objective 1, just because of the trial timelines and the need to report on the evaluations within the scope of YEF's current endowment, and also to meet wider kind of like policy objectives and things, we're only able to run the current call, which is ending on Monday, because if we were to run a later call, then the timelines would need to extend beyond the current parameters of ending around 2029, 2030. So for objective 1, we've just got that one call.
Thanks, Ben. There's another question about size of the organisation applying. Will a small micro charity still be considered, or do we have this already? It's similar, I think, to an earlier question.
Sure. So we can absolutely apply we can receive proposals from any registered charities and community interest companies. We would just need to, if it is a very small charity, we would just need to consider if you're applying for a grant that was more than your. Sorry, so let me word this correctly. So if you're applying for a grant that was every year more than your current organizational turnover, then we would need to consider during our due diligence process at co-design whether you'd be able to kind of handle those finances just because of our responsibilities around public money. But there's absolutely, we're not setting a cap on or a floor around how much organizational income each charity needs to process. If this is a worry for you, so say if your annual turnover is many times less than what you'd be seeking in terms of a grant, what you might want to consider doing is partnering with a larger organization who could act as our main grantee and then disseminate funding.
Thanks, Ben. Okay, we've got a number of questions that come in the last few minutes. Did you say an organisation will be funded throughout the co-design period?
Yes, so during co-design, we'll negotiate a budget with each participating organisation to cover the staff time that they're putting towards the co-design process. For a 4-month period, that would be up to a maximum of £20,000, and we'd ask you to propose a budget when it was a bit clear about the scale of responsibilities towards co-design, how many likely workshops there's going to be, how much work outside of those workshops is likely to be. We really want to make sure that we're funding organisational time, even though it is part of our application process. And just to flag that, even though there is another decision-making point before going into setup and delivery of the evaluation thereafter, where it'll be up to YEF's approval on whether to progress, even if you weren't to progress to setup and delivery, you would still receive that funding for participating in the co-design process. That maximum £20,000 is for the standard 4-month co-design. If you were to have an extended co-design process up to 13 months, then the budget could be scaled moderately up, not kind of on a one-to-one scale. So it wouldn't be, say, up to 40,000 up to 8 months, just because we wouldn't have expected the same intensity of participation across that full extended period. But we would be able to scale up the maximum budget that you could ask for.
Thanks, Ben. Question, does the intervention have to be with schools, or can it also be youth clubs, sports academies, etc.?
Yeah, so I think if it was delivered by youth clubs, sports academies, we would just need to really understand how close your relationship is with those schools and how well integrated it is. So a key part of this objective is trying to build that school level capacity to identify and respond to these behaviours. And so we generally would expect that the delivery would be really well integrated in schools, maybe mostly on school premises, sometimes outside of school premises, so long as there is that partnership, there is that feedback mechanism going back and forth from the school to this other organisation. So it's not a blanket ban on youth clubs or sports organisations by any means, but it would need to have really solid integration with the school. It couldn't just be a referral arrangement.
Thanks, Ben. Would you consider programmes where the behaviour is directed at female parents or carers?
That's a good question. So we know that there's disproportionality around child to and adolescent to parent violence and abuse, particularly that it's often directed towards mothers. For the scope of this objective, we're thinking primarily around peer abuse, so trying to address those emerging forms of harm that could eventually lead to kind of peer-on-peer abuse around children, young people, and preventing violence against women and girls long term. I believe there are other strands of work going on at the DfE and Home Office around CAPVA. So I would recommend that if your intervention is more around addressing child-to-parent abuse, that you keep an eye out on those work streams, but it wouldn't necessarily be within scope for this objective.
Thanks, Ben. If an organisation is applying for Objective 1 and Objective 2, would you be able to use the same schools for interventions?
It's a very good question. I think we might be able to consider it on a case-by-case basis. I can see the advantage of it, because if you're taking part in Objective 1, then you're doing that universal provision, and you might be able to identify better children and people who need better support, further support. And so they could then be referred to an intervention that takes part in Objective 2. But I still think it's probably quite unlikely, just because these two interventions might be trying to operate at the same outcomes. And so there would be potentially a high confusion of the evaluation design, potential for contamination of intervention and outcomes, and overall just bringing in a lot of static and noise into the evaluation design. So I think I would probably recommend applying to this objective, assuming that you would need to deliver in completely separate locations, and maybe coming back to this a little bit during co-design. Would that align with your thinking, Phil?
Sorry, I was caught up in the questions there.
No,
Just summarise that.
Yeah, no problem. I'm basically saying it's we could maybe consider it during co-design, but because of the potential for contamination, because these two objectives are working on quite similar outcomes, it would be quite hard to tease apart the effects of the interventions from each other. And so probably we'd really encourage people to expect that if they're applying for an intervention with Objective 1 and applying for intervention with Objective 2, they'd have to work in completely separate locations.
I think that's right. The key point is that for the young people you're giving the targeted intervention to, they are also receiving the universal intervention. So in there's you're not just testing your targeted project, you're testing the targeted project plus the universal intervention for those young people. That changes the research question. Yeah, thanks. I'm just running through Jones. Okay, thanks. I think I'll come to that in a second. Do we include a budget for the co-design process in the application, or is that dealt with afterwards?
So I was actually typing a response list. No, thank you. Please don't include the co-design budget in your budget proposal. We'll negotiate that separately. So the budget that you're bringing is just for setup and delivery of the intervention within the context of a feasibility or pilot study, depending on what you're proposing. Please, we'll think about the co-design budget separately.
Thanks. From your experience assessing applications, what are the strongest characteristics of successful proposals, and what are the most common weaknesses applicants should avoid?
Good question. I think we probably all have different opinions on this. For me, I think what we're really looking for is clarity, so that we can understand in quite a manualized way, we hope, what your intervention is, that there's a really strong hypothesis for why the activities are going to lead to the intended outcomes. So having that described in a really structured, clear way is really often what separates maybe weaker proposals from stronger proposals. Actually, I think this is a good question, because maybe we can mention the use of AI in while we're discussing this. So if people want to use AI when they're developing their proposals, then they're welcome to do so. I would just recommend that you think about whether AI is actually adding that clarity, because AI can sometimes structure things in a really accessible way. Other times it can actually add in a lot of unnecessary adjectives and buzzwords that actually confuse the overall intervention design. So by all means, please do use AI, but just use it in quite a semi-critical way, I would say. Sorry, what would you say, Phil?
On the use of AI?
Both.
Or generally, yeah, I would agree. Clarity and to get across your thinking process behind your project, why you believe it's going to be successful, and that's the key thing, really.
Lovely. Sorry, I know we might have some more questions in the Q&A function, but I just mentioned at the start that we would, if anyone's can't use the Q&A function and would only be able to ask a question by coming off mute, please raise your hand now and we'll take you off mute temporarily so that you can ask that question.
Hand raised, but I think it's come down now. So we'll carry on with Q&A. Thanks. I'm not sure we can answer this question now, but what data or evidence is there that shows children know what abuse and harm is? Anything like to add into the moment?
I don't mind coming in on that. I mean, I think we know that amongst the population in general, but particularly amongst children and young people, they often find it harder to identify what are harmful behaviours, and particularly with technology and social media, I think that's definitely changed some of the patterns and the way that young people identify what is harm. I think for this programme, that is something that we're interested in interventions being able to respond to and tell us about how they work with young people to be able to identify what is harmful behaviour and the impact that that can have on others. I don't know if either of you want to add anything to that.
Thanks, Jess. Shall we move on to the next question? Would a sixth form college where students are 16 to 19 be allowed to do a joint application?
So we're absolutely open to receiving proposals for delivering in sixth form colleges. Generally, we would expect that those are working with 16 to 18-year-olds, with maybe the possible exception that if organizations are intended to work with schools that are specialists and working with children and people who have special educational needs and disabilities, we might extend that up to an age of 19. Generally, I think we wouldn't expect in mainstream settings for 19-year-olds to be referred to these interventions, just because you are starting to get quite into that adult space at that point and outside of the mainstream settings. We might be able to think about this a bit more in co-design. If it's really key to your application that you want to work with 19-year-olds in school settings, then maybe if you wouldn't mind just emailing our grants inbox separately and we can have a bit more of a think about it.
Thanks, Ben. Where an intervention has an evidence base in another setting but is new within schools, would you generally expect applicants to propose a feasibility study before a pilot RCT? Would proposing a more ambitious evaluation design create concerns at the assessment stage? Shall I have a go and you come in? So if you were proposing a feasibility study, it would be because you were interested in whether it's feasible in terms of implementation or feasible in terms of evaluation. So from your example, it suggests that perhaps you're comfortable that the evaluation is feasible. What we'd be looking for is your thinking about whether delivery would be feasible within the school. So I think it depends how certain you are whether that the delivery in school is feasible, whether you need to test that in a feasibility study, or whether you're very confident with that and you can sort of back that up in a sort of pretty robust way that would mean that it's acceptable for a pilot RCT. Anybody else like to come in on this?
No, I think that's good coverage. Thanks.
Okay, thanks. Next question. Earlier it was said you could be eligible if delivered in community settings but new to education, but the scope says the following is not in scope. So can we clarify this? That scope says programs delivered primarily in community settings with only limited links to the education settings are not in scope.
I can take this, yeah. So for this objective, we are open to receiving proposals for interventions that have previously been delivered in the community, but that you are now proposing to deliver in an educational setting, so long as you've got the organizational experience to kind of facilitate that. So experience kind of working with schools, working in this space to do that transportation from community to educational settings. But that for your proposal, you do need to be delivering with a very close link to educational settings for this objective, either within school premises or very closely aligned to school premises, where there's that kind of feedback mechanism, and you're improving the school's capacity to identify and respond to these behaviours outside of just this intervention. I hope that clarifies it.
Thanks, Ben. I've covered all the questions. Just double check. I think we've covered all the questions. If anybody has a question that hasn't been covered, do you mind putting your hand up? Perhaps. Hi, Debbie. Thanks. Could you let's see, can we come off mute for Debbie?
Yeah, so Debbie, I've just clicked to allow Mike, so you should be able to come off mute now. Maybe a dialog box came up.
Is that okay? Hi, sorry, I don't think you covered my question. I was just, my name is Debbie, I'm from Action Break Silence. We have extensive experience delivering VAWG prevention in primary schools in year 5 and year 6. It's a 16-hour program. We've always done that with a whole school approach, which is we couldn't apply for objective 1 because that was from 11 years plus, and we're focusing on year 5 and year 6 students. So there were 2 things that concerned us. One is removing kids from a classroom. The schools that we work with were concerned that if you handpicked and removed certain boys from a class, that would be unhealthy for them. And not be inclusive. And also it very much steers away from what government has really tried to push and promote with regards to a whole schools approach. So for us, we sort of trying to work out, we tick all of the boxes, but we don't remove, we don't isolate the children that have displayed that harmful behavior or attitudes.
Come in on this. Thanks, Debbie. So the key factor for this funding call for objective 2 is that the intervention is targeted. So your intervention would need to be targeted. The mechanism by which you are able to deliver that just to the targeted children would be what we'd be looking to see you describe in your application.
Okay, thank you very much.
Thanks, Debbie. Hannah.
Sorry, Hannah, I'll take you off mute. Oh no, you're off mute now. Should be able to come off mute. Are you able to come off mute, Hannah? There might be a dialog box.
Hello. Hello.
Hi.
Can you hear me now? Hi, sorry, I might have missed, I know somebody asked this question and I might have missed the answer. So if you've done interventions in schools previously, which were evaluated but some time ago, and you want to return to that and reevaluate and make that evaluation more up to date and that intervention more up to date, would that be included?
I can take this perhaps. Thanks, Hannah. The key thing is, what extra do you want to learn on top of what you learned in the previous evaluation? So has something fundamentally changed in the project, in the characteristics of young people? Is there some environmental factor which means it's significant to ask that question again and find out answers because the context has changed, or you want to ask different questions? I think we want to avoid asking the same questions for the same intervention, the same broad cohort, unless something significantly has changed.
Thank you.
Thank you. I'm aware that it's 3 o'clock.
Yeah. Wonderful. Thank you for sharing that, Phil, and thanks everyone for your questions there. I think we've just about managed to get to them all, but if we haven't, then please do email grants@youthendowmentfund.org.uk, and we can respond. We'll also be uploading this recording and the slides and updating our FAQ on our website. So yeah, we look forward to receiving your proposals, and thank you very much for your time today.
Thanks so much, everybody.
Thanks, everybody.
Thanks, everyone. Bye.